Hello, everyone. Welcome to today's Nicaragua webinar entitled Teach-In and Toolkit Launch, Sanctions Undermine Children's Right to Health. Buenas tardes. Bienvenidos y bienvenidas a la serie de seminarios de Nicaragua. El tema de hoy es Sesión de Educación Popular y Lanzamiento de la Caja de Herramientas. Las medidas coercitivas socavan el derecho a la salud de los y las niñas y niños. My name is Becca Rink, and I'm your moderator today. We'll hear from our speakers in a few minutes, but first we have some other announcements. The primary sponsor of today's webinar is the Nicaragua Solidarity Coalition. We also thank our many other organizational sponsors, co-sponsors, who will be listed in the chat. A word about the organizations that are co-sponsoring today's webinar. The Sanctions Kill campaign is an activist project that exposes the humanitarian impacts of economic coercive measures, aka sanctions, and what can be done to end them. The Americas Without Sanctions is a project within Sanctions Kill that highlights efforts made by the revolutionary governments in Cuba, Nicaragua, and Venezuela to prioritize human needs, resulting in ever-expanding rights for their populations despite U.S. and Western hybrid warfare. Please feel free to use the chat function to offer comments throughout this event. We ask you to use it in respectful ways that don't distract from the program. Please put your questions for the speakers in the Q&A. See the button at the bottom of your screen. We will select your questions from the Q&A to pose to our speakers. This webinar is being recorded, and the recording will be sent to all registrants within the next few days. When it's ready, it will also be posted on the website of the Nicaragua Solidarity Coalition, nicasolidarity.com, and also its YouTube channel. If you'd like to become more active in supporting Nicaragua's sovereignty and opposing foreign interference, please join the International Nicaragua Solidarity Coalition. You can check out our website regularly for updates and new resources at nicasolidarity.com. Subscribe to the newsletter, monthly meetings, action alerts, and other notices from the Nicaragua Solidarity Coalition. See the link in the chat shortly. The next general meeting is on Monday, May 11th. The coalition meets on the second Monday of each month at 2:30 p.m. Eastern Time. Email the coalition for the Zoom link. See the email in the chat. We're also putting other links in the chat to subscribe to the NicaNet email list and Nica Notes and download ebooks about Nicaragua. This information will be in the chat. To stay up to date with events and issues in Nicaragua, subscribe to the NicaNet email list, a Google Group moderated list. The link will be in the chat. Please read Nica Notes, subscribe for weekly articles by an invited author, followed by news updates of the week. Several ebooks about Nicaragua are available at afgj.org, free in English and Spanish and downloadable in several formats. To find the ebook, scroll down toward the bottom of the page and look on the right-hand side. And now we turn to today's program and our four speakers. First, we're going to hear from Jill and Jess from the Americas Without Sanctions team, who are going to present a new PowerPoint about how coercive measures impact children's health, and which will soon be available to you to download from the Sanctions Kill website. Then we will hear from Anaí Arizmendi, a Venezuelan journalist and expert on the impacts of unilateral coercive measures on children. After Anaí, we'll hear from Ajamu Baraka about people-centered human rights. And then we will have 30 minutes of discussion among the panelists and you in the audience. Please do keep entering your questions into the Q&A throughout the webinar. We will start with Jill. Jill Clark-Golub is the coordinator of the Americas Without Sanctions, a project of the Sanctions Kill campaign, a member of the coordinating committee of the Nicaragua Solidarity Coalition, and a member of the Black Alliance for Peace Solidarity Network. She's published articles in various alternative media outlets. Jill, you have the floor.
Thank you, Becca. I'm going to try to share screen now. Let's see. There we go. All right. And please let me know when you're seeing this in full screen. Are you seeing this in full screen? Oops. Just a second. Are you seeing me? And now let's put that in full screen. I don't know why you're not seeing this in full screen, are you? Let's see, slideshow. All right, I think we just need to go on. Okay, so thank you, Becca. I first want to thank Natalia from our team, who made a huge contribution to this effort. And I apologize that today's PowerPoint is a bit rushed because we want to have time for a rich discussion with our invited guests. But the complete finalized presentation will be available to activists in the near future. And this is part of a campaign to raise awareness of the over 250,000 children under age 5 who die every year from economic sanctions, which are hypocritically justified as protecting human rights. We will use Cuba and Venezuela as case studies to show how children die due to US imposed sanctions. And today's program will challenge us to rethink traditional approaches to human rights and demand an end to child killing sanctions. And so we're going to see what sanctions are, international laws that are violated by them, the case studies, and some recommendations and discussion. So I invite you to check out existing tools on the Sanctions Kill website by clicking the Sanctions Toolkit on the landing page at sanctionskill.org. This brings you to an excellent video by Margaret Flowers and a downloadable PowerPoint explaining the basics of sanctions, such as how they restrict trade, block financial transactions, reduce foreign aid, may include travel bans and other things. And they kill people essentially by destroying economies and preventing access to basic necessities like food, water, energy, and transportation. And they violate all of these international laws. Let's look for a minute at the Convention on the Rights of the Child. This is the convention that has the most signatories of countries around the world. Every UN member nation, except the United States, has ratified this convention. It includes an obligation of states to reduce infant and child mortality, provide necessary medical assistance and health care, combat disease and malnutrition, ensure proper pre- and postnatal health care for mothers, and to protect the rights of disabled children. And what does the United States use to justify the unilateral coercive measures that it imposes on other countries? Well, here are two typical examples from legislation against Cuba and against Venezuela. It always starts with, it is the sense of Congress that, and the litany of accusations, such as the government of Fidel Castro has demonstrated consistent disregard for internationally accepted standards of human rights and for democratic value. That's from the Cuban Democracy Act of 1992. And here from the Venezuela Defense of Human Rights and Civil Society Act of 2014, we have a quote from Human Rights Watch. Under the leadership of President Chavez and now President Maduro, the accumulation of power in the executive branch and the erosion of human rights guarantees have enabled the government to intimidate, censor, and prosecute its critics. So let's see what the US is doing about human rights. New findings, the largest study ever conducted on the impacts of economic sanctions and mortality that looked at 152 countries from 1971 to 2021 was able to determine causality. and found that the number of people dying from economic sanctions is well over 500,000, and that is comparable to the number of deaths from armed conflict. Most of the deaths are children under age 5. But this is part of a growing body of evidence. It is not just one study. UNICEF found that infants exposed to sanctions during pregnancy are likely to be born at below average rate. And sanctions disrupt the procurement of the elements needed to grow food and exacerbate the incidence of hunger and malnutrition in children under 5. Humanitarian exemptions in sanctions regimes fail to facilitate access to medicines required to treat curable child cancers. A child with cancer might die waiting to get treatment, and children awaiting transplants are denied treatment and die because third countries, banks, and private companies are overly cautious in dealing with sanctioned countries. And sanctioned countries have trouble importing basic medicines. And countries can't maintain their drinking water systems, which increases waterborne illnesses that are particularly deadly for children under 5. And sanctioned countries cannot receive international donations and assistance to save children during natural disasters. There is a growing consensus that these unilateral coercive measures pose a critical impediment to the right to development and hinder the achievement of the 2030 sustainable goals, particularly to eliminate hunger, to protect health and well-being, to have clean water and sanitation, and to reduce inequalities. And with that, I will turn the floor back to Becca to introduce Jess. Thank you.
Thank you so much, Jill. So Jess Cruz is a Cuban-American organizer with the Party for Socialism and Liberation, PSL, based in Miami, Florida. She's also a PhD candidate in Latin American and Caribbean history at Yale University. In her research, she studies how Miami has historically functioned as a central node for a multi-generational network of counter-revolution across the hemisphere throughout the late 20th century into the present. Jess will present the case study on Cuba. Jess, you have the floor.
Thank you so much, Becca, and everyone for being here. Can everyone hear me as I'm figuring out the slideshow?
We hear you well.
Perfect. Thank you so much. Okay, let me edit this. Okay, so what did I do last time? Here we go. Y'all see that in full screen?
Yes, thanks.
Okay, sorry, I lagged for a second. Okay, cool. All right, so I'm gonna time myself. All right. So, hi everyone, thank you again so much for being here this Sunday afternoon. I'm gonna jump right into it to be respectful of everyone's time. So for nearly the last 50 years, infant mortality in Cuba has been lower than neighboring countries in the region. So today I'm going to be breaking down some of the programs that have contributed to why Cuba's healthcare system, particularly when it comes to infant and child's health, for today's presentation, has been a guide and driving force for progressive and revolutionary social movements that are driven around collective liberation and popular sovereignty. I will also be bringing in how these programs and institutions are being directly affected by the continued US genocidal blockade waged against the island. I visited the island this past month through the Let Cuba Live Brigade with the People's Forum, and we were able to visit a maternal home and the Juan Manuel Marquez Pediatric Hospital, both located in the municipality of Marianao in the province of La Habana. Although I won't have too much time to go into a formal report back right now, I'm incorporating what I learned from the conversations that I had with nurses, with physicians, and other medical professionals into this case study presentation, and also can answer any questions that you have in the discussion portion. Right. Why is it not letting me move? Okay, perfect. So the national healthcare system built throughout the 1960s after the triumph of the Cuban Revolution in 1959 was not only a phase or a discursive measure. It was first legally enshrined in the 1976 Constitution, which was adopted through a national plebiscite in the 1983 Public Healthcare and the 1983 Public Health Law, which was centered around several foundational principles, some of them being that healthcare is a right, it's available to all equally and free of charge, that it was a responsibility of the state, that preventative and curative services were both integrated within the same system, and that the public should be an integral part of the health system's development and functioning. And lastly, that healthcare activities are the driving forces of economic and social development. So this means that medical internationalism is a fundamental obligation and commitment of this revolutionary healthcare system. So in 1976, alongside the writing of the Constitution, we see the creation of the newly established Ministry of Public Health. The underpinnings of this ministry was the intentional fusion of medical education and community-based practices. So some examples of this being the emphasis that's placed on medical and nursing schools being established across multiple provinces to promote the responsibility for professionals to begin practicing in the regions where they grew up. We also saw this through the creation of the Rural Medical Service, or the RMS, in 1960, where hundreds of recently graduated physician volunteers began to live in rural communities across the island over the next decade, establishing multi-generational bonds between medical professionals and the communities within which they lived and were raised within. All right. So the next example that builds off of the RMS and the Ministry of Health was the creation of polyclinics. So once again, most of these programs that I'm going to be speaking on today build off of one another with the understanding that the healthcare system is part of a larger, continuous and dialectical revolutionary process, one that is dynamic and is transforming to meet the needs of the people on the island and is not limited to what is said in the Constitution. It builds off of it is what I'm trying to say. So according to research that was led by Keck and Reed, the creation of a new model of community-based polyclinics in 1974 emerges out of the tensions that remained after the establishment of the nationalized public healthcare systems, including patients having long waiting times, that the system was still too hospital-oriented, and that there was still a gap in the continuity of medical care from general to specialist. So polyclinics were made to help provide a link between primary healthcare based within local communities and then hospitals. So this went hand in hand with medical education, where health workers were driven to understand community health not only through their health status, but also the many overlapping social, cultural, and economic factors that inform it. So we then see the creation of a comprehensive family practice in the 1980s, responding to the tensions regarding the continuity of care that stemmed from primary doctors to specialists, right? And how to more deliberately connect preventative and curative care to one another. So this specifically happens in 1983 with the coining of the family doctor and nurse plan. So what did this entail? It consisted of a local polyclinic connected to the transformation of the medical education system on the island, leading to the program's nationwide extension and development of a new specialty pursued in a postgraduate residency program named the Comprehensive General Medicine or Family Medicine. So this was codified within the healthcare system, and it was the meshing of both public health and clinical medicine into a converged field that solidified the connection between the simultaneous improvement of the individual and population health outcomes as its central motivation force. So this meant that a team member's ordinary day on the job was divided among office hours in the morning and the afternoon being designated for house calls for around 120 to 150 families. Historically, some of these family doctors and nurses have also been sent to large factories, schools, boardships, child care centers, homes for senior citizens, and maternal homes, which is what I'm going to bring up next. With this, the nurse within this system acts as the foundation for this holistic community-based medical model that's founded upon prevention. So this leads me into the creation of maternal homes, or hogares materno, right? For individuals with high-risk pregnancies. I'm so sorry. For individuals with high-risk pregnancies. So all provinces, through this approach of the polyclinic being the first line of specialty services alongside physician specialists, have at least one general, one maternity, and one pediatric hospital, with some having more, the example being in La Habana. And I was able to go to one, so some of these photos are of a maternal home that we were able to visit in Marianao. Across the island, there's a total of 336 maternity homes. Made with individuals with high-risk pregnancies in mind. The way that these maternity homes work is built upon a more extensive built system that is centered around holistic prenatal care. So during pregnancy, pregnant individuals are seen over 12 times. Pregnant individuals that have been screened by any community member within these polyclinic officials as having a medically or socially risky pregnancy are seen more frequently. And one of the features of this approach is the provision of maternity homes that offer free residential accommodation for several weeks before birth. At the maternity home, pregnant individuals are given free meals to ensure adequate nutrition for both the pregnant person and the fetus. Education about the importance of diet and the minimization of risk factors such as alcohol and tobacco is given. And this has been directly connected with prenatal care being provided for more than 95% of pregnant individuals by the end of their first trimester across the island. Each child is seen regularly during infancy, fortnightly for the first 6 months, and monthly between 6 to 12 months, and early childhood by the primary healthcare team. This is accompanied by more frequent visits that are arranged for infants that have chronic illnesses. Not only do these checkups occur in the consultorio, like their community-based doctor, but they also occur in the patient's home, ensuring that health professionals are able to have an in-depth insight into the infant and how to help the family as well. This is connected to an extensive understanding by the Cuban healthcare system that the first 1,000 days of life, from birth to 2 years old, lays the foundation for development and lifelong health. So the next point I'm going to go over very quickly is just introducing y'all a little bit to the 1,000 days approach, right? So alongside the sustainment of these maternal homes, for the same reason of the cruciality of the first 1,000 days of life, the Cuban revolutionary government implemented a comprehensive care system that promotes infant and child development. So examples of this, or how this looks in everyday life, is the promotion of an active family and community participation in a child's life, with the program's foundation being on the principles of equity and intersectoral involvement, including the role of social welfare programs embedded in public health. So Cuban children receive early education services through institutional and extra-institutional means. The institutional one being daycare centers for children of working mothers or working individuals, which infants are able to attend as soon as they are able to walk up until they reach 6 years old. The extra institutional means is through the Educate Your Child program, which has been implemented across the region in countries like Mexico and Brazil, right, which consists of program promoters in each community recruiting and training volunteers to deliver early childhood education. So this is another example of how it's multi-sectoral, where it brings in the Ministry of Education, it brings in cultural organizations, sports, radio, television, and research centers and universities. So some accomplishments that have been connected to this approach, particularly the importance of the connection between preventative and curative services within this system, is that Cuba has historically had a record of over 98% of full immunization by the age of 2 years old. We're vaccinating children against 13 plus illnesses, right? So I had a slide on milk banks, which I could answer questions if people are interested and provide more resources on, but I am cutting a little close to time, so I'm going to skip this. But in the meantime, you could look at this slide. So I'm just going to go very quickly on how these different programs are affected by sanctions and the blockade, right? So the US blockade prohibits the selling of technology that contains 10% or more US components to Cuba. So what does this mean? This means that all medical equipment, with examples being infusion pumps and ventilators, right? This is one of the kind of the main discussions that we were having within the brigade and with nurses and physicians, that are produced by US companies or non-US companies that contain more than 10% of US parts cannot be sold to Cuba. This has resulted in shortages of medicine, of testing equipment, and consumables within the healthcare system, right? The escalation of the US blockade, particularly the 2026 energy restrictions, has turned the destruction of like Hurricane Melissa, for example, which has damaged over 215,000 homes, right? 642 health centers into a deepening child health crisis, where more than 32,000 pregnant individuals face reduced access to essential prenatal services, and infant mortality has risen from 7.1 to 9.9 per 1,000 live births from 2024 to 2025. So this is kind of seeing the comparison with the US. And from 2024 to 2025, alongside a neonatal mortality rate of 4.2 per 1,000 death of 2024. So just wanting to end very quickly, since I'm going a little over time, I do want to emphasize that there is a political commitment to this socialist and community-based healthcare system that is unwavering. So while speaking to a lot of nurses and doctors at the Juan Manuel Marquez Pediatric Hospital, they communicated that what would be a 2-hour operation has become a 19-hour operation due to the fact of what I brought up about medical technology. And while I was there was the wiping out of the electrical grid and this direct fuel blockade. And they were working with 61% of their staff in the hospital, and yet the amount of checkups and operations remained the same within this system, felt completely in line with this system that has been built across the last 3 decades. There was no change in their approach to patients within this hospital. And to add, this was a hospital that responds to the needs of the entire island, providing transportation for families from different provinces to receive direct medical care. Just to cut it a little short there, but if anyone has any questions, I could go into more depth. But thank you so much. And I'll pass it back to, I think it was Jill that's going to be doing the next case study.
Yes, thank you, Jess. And let's see. Whoops. Oh, shoot. Let's share screen. Okay. All right. And now I'd like to tell you about the case study of the US blockade on Venezuela and the impact of that blockade on child health. So Venezuela also has laws to protect children and protect their health. And it's in the Constitution, and also separate laws for children. They're special subjects of constitutional rights. Children's rights are a shared responsibility of family, state, and society. And a system of comprehensive protection includes courts, administrative bodies, and social services. And children's life, health, and nutrition constitute a core category of rights. So Venezuela has various programs to deliver on these rights. In the area of healthcare, there's, of course, national free vaccinations for small children. The Misión Barrio Adentro is a program to expand access to primary healthcare and prevention. This is also like the community-based healthcare system Jess was describing in Cuba. The Misión Niño Jesus prevents maternal and infant mortality, and the Humanized Childbirth Plan improves access to dignified childbirth. There are programs to improve nutrition, such as the Food Mission, Food Subsidization and Distribution Plan, the CLAP program that provides critical nutrients for children, the National School Feeding Corporation that ensures nutritious food for school children, the NutriLife plan that increases the nutritional value of CLAP products, and poverty reduction programs such as the Homes of the Fatherland mission that expands access to food and healthcare in low-income households with children. But then we have the introduction of the US unilateral sanctions targeting Venezuela's oil industry. This started in 2015 with Obama's executive order that declared the situation in Venezuela an extraordinary and unusual threat to the national security and foreign policy of the United States. And this is a standard phrase that is used at the start of and renewal of sanctions regimes that the US has imposed on various countries. In 2017, we had the maximum pressure sanctions, financial sanctions, preventing debt renegotiation. In 2019, the introduction of an oil embargo. In 2020, secondary sanctions and the diesel exemption was revoked. And this goes on to 2022 with the oil for debt and Chevron license, a lifting of restrictions on 2 European energy companies, and an order allowing Chevron to resume extraction activities in Venezuela, and a temporary reprieve, the 6-month sanctions waiver allowing Venezuela to sell oil to global customers. Let's look at the impact that this has had on the economy of Venezuela. Here we can see 2013 to 2024, crude oil production plummeted down to its low point in 2020. And this coincides with the executive order, maximum pressure sanctions, and the oil embargo, and then temporary reprieve. In terms of real GDP, we see the same plummeting coming to the low point in 2020 with some relief with the oil for debt and Chevron license. And let's look at the impact of this on, let's move this, on children's health outcomes. So here's undernourishment in Venezuela, that's the pink line, and in Latin America and Caribbean average. You can see that Venezuela was below the Latin American average from like 2003 to 2014, thanks to programs implemented by the Bolivarian Revolution. But then again, with the executive order and the maximum pressure sanctions, undernourishment skyrocketed. And here, then, the relief. Let's look at infant mortality. Again, under the Bolivarian Revolution, Venezuela was under the average for Latin America and the Caribbean. But with the 2015 executive order, we had an uptick and then a plateau with what has happened subsequently to that. And here's under 5 mortality, which is what our health workers letter is all about. Remember, that's the biggest age block that dies from sanctions. And again, the Bolivarian Revolution had good health outcomes, better than the average in Latin America and the Caribbean. And with the impact of the executive order and maximum pressure sanctions, it also significantly ticked up, and here it is at a plateau. So what does the blockade of Venezuela show us? It shows that definitely US economic coercive measures undermine efforts to promote children's health. The unprecedented declines in oil production and foreign revenue loss, combined with ongoing restrictions to financial transactions, undermined the Venezuelan state's capacity to import food and medicine. This resulted in supply shocks and currency destabilization, which contributed to hyperinflation and intensified consumer dependence on severely constrained public services in the nutrition and health sectors. Food, medicine, and public health services critical for child development and well-being were inaccessible. This contributed to a surge in child undernourishment, infant mortality, and under 5 mortality. And with that, I can stop sharing and let Becca introduce you to our expert on Venezuela and the impacts of sanctions, of unilateral coercive measures on children.
Thank you so much, Jill. Now we're going to hear from a Venezuelan who's studied this topic extensively. She'll be speaking in Spanish, so if you need interpreting, be sure to click on the world map below in order to get interpreting. And if you don't see it, click on more with the 3 dots and the interpreting should come up for you. Anaí Arismendi es periodista venezolana con maestría en Derechos Humanos y doctorado en Ecología del Desarrollo Humano, activista por los derechos de la infancia y las mujeres. En 2023 publicó el libro Infancia bajo asedio sobre las medidas coercitivas unilaterales y los derechos humanos de los niños y las niñas, y en 2025 publicó Simón Rodríguez, Derechos de los niños y las niñas desde el sur. Ha sido condecorada con el Premio Iberoamericano, el Premio Nacional de Periodismo Simón Bolívar y el Premio Aníbal Nazoa. Anaí, gracias por estar aquí con nosotros. Tienes la palabra.
Thank you very much. Thank you to all the organizations.
I want to thank all of the organizations that have allowed us to reflect on a global topic that is so important for the protection of children. The first things that I want to say is that the sanctions are a part of the politics, of the foreign politics of the United States, and they are used as a tool for war, and these are used against governments that are uncomfortable. They have a collective impact on the population of the countries affected. They are a collective punishment against our people. This is a strategy that is impacting 31 countries. That's 28% of the global population, and around 37,000 coercive measures are affecting 200 million children from 0 to 14 years of age in the sanctioned countries. Venezuela is the third country with the highest number of sanctions from the United States, Canada, and from the European Union. The country has been subjected to concurrent impacts, coups, induced migration, and recently on the 3rd of January, a military action where Maduro, our president, was kidnapped. There were many deaths as well, and Celia Flores was also kidnapped. This violates human rights, it violates international law, both all types of laws. From 2015 to now, there are more than 1,000 measures that are being implemented. They affect our development. We should say that from 2015 to now, we have failed to receive $600,000 million. 9 of every $100 we should have been receiving, we were actually receiving. This has affected all social programs and investment programs. Despite this, the country has not stopped. An important point is that 70% of the government spending is towards social programs, particularly to guarantee health and education. So before Obama's order, Venezuela had almost achieved all of the Millennium Goals. After the order, there was an increase in the malnutrition index that is linked by the FAO to access to food. We also saw an increase in mortality, infant mortality below 5 years old. We used to have the smallest index, and it rose to 20 points. After these impacts, these measures, we see that the measures being taken by the government, the social programs, have decreased the impacts of this. These programs seek to help the vulnerable populations and the population in general. When we talk about data, we always have to know that we're talking about people, children, human beings that are affected in their development and their right to health. In 2015, Venezuela did not have incubators. We couldn't take good care of newborns. Given the impacts of the measures, the countries that were providing help with these incubators no longer worked with Venezuela. Thank you to all the efforts of the Venezuelan people, the popular organization. We were able to rescue incubators with local tools, with local knowledge and technology. And it also was guaranteed by the medical teams. You may have heard of a part of PDVSA, which is our oil industry, which was also, in a sense, kidnapped by the opposition and the government of the United States. This decreased access to funds that were used, for example, for transplant procedures. There are people with chronic diseases that were also affected because of lack of funds for the medical programs. The pediatric hospital decreased its number of operations substantially. We need to say that after 2016, several pharmaceutical companies left Venezuela, given the pressures of the sanctions. This forces to strengthen our local pharmaceutical industries. In this extraterritorial policy, these measures are affecting medicines and food. They are being weaponized. This policy didn't even stop in 2017 while COVID, which was one of the most lethal pandemic of the century. We see that in 2021, our president, Nicolás Maduro, said that the acquisition of vaccines, the funds were blocked in the international financial system. He demanded that the vaccines that were already paid for be sent to the country. Nonetheless, that did not happen. Furthermore, Lone Star, which is a US company, blocked the income of 6 million vaccines for different types of diseases. Diphtheria, tetanus shots, yellow fever, all of which were destined to the Venezuelan population. COVID showed that the true pandemic is inequality, and it's this inequality among countries that are affected by measures, coercive measures were affected much more strongly than those that were not. Venezuela was unable to access vaccines and different technology. Nonetheless, Cuba and other countries that showed solidarity helped out, and so we saw vaccines created by Cuba that saved lives in Venezuela and other countries as well. More than, let's remember that COVID, this confinement, brought about situations like what the WHO qualified as mental affectations. We should say that as Elena Dohan said from the UN in her report in 2021, the lack of medication, specialized medication, the possibility of getting access to them, just like Cuba and Venezuela saw, that affected the population, not only medically, but with the mental health as well. Coercive measures are a crime against humanity, and they violate the Rome statutes. We're talking about a constant, systematic affectation of a population, a civil population. That means the present and the future of our people. It is a threat to the Convention of Children's Rights, which establishes clearly the right to health. And that has to do with the difficulties that we were affected by. Children have rights. They are the protagonists. They have a right to development and life. So they transform children as those having rights to those being affected, sacrificed by the measures. It affected national programs that sought to seek Millennium Goals and Sustainable Development Goals of 2030. Therefore, these are extermination policies that constitute a problem to everyone, for everyone. And we think that we need to save humanity and raise our voices for children in the world. These are rights. There are rights to health, and we need to consider it an integral right. We need to have access to medicines, to food, to have access to a system that allows them to seek health care. Today, the rights are being threatened. So I invite everyone to raise your voices against coercive measures.
Por eso, invitar a todos y a todas a alzar nuestra voz contra las medidas coercitivas unilaterales. Gracias.
Muchísimas gracias, Anaí, para esa presentación tan interesante. Veo que tenemos mucho que conversar durante el intercambio, así que por favor, si tienen preguntas o comentarios, pónganos en la sección Q y A abajo. Now we will hear from Ajamu. Ajamu Baraka is the founder of the Black Alliance for Peace and founding director of the North-South Project for People-Centered Human Rights. In 2016, Ajamu was the candidate for Vice President of the United States on the Green Party ticket. He serves as the executive committee of the U.S. Peace Council and the leadership body of the United National Anti-War Coalition, and is an editor and contributing columnist for the Black Agenda Report. In 2019, Ajamu was awarded the U.S. Peace Memorial's Peace Prize. Thanks for being with us today, Ajamu. You have the floor.
Thank you so much for that gracious introduction. And it's indeed an honor to be part of this very important conversation. And I thank the organizers for allowing me to participate. My comments will be brief. What I want to do is to point out basically that this conversation, this attempt to grapple with and understand human rights, and in fact, its relevance is a very important conversation. The idea of human rights and its evolution had a contradictory character. It had enormous possibilities, but also enormous limitations. In 1948, for example, we had the creation of the Universal Declaration of Human Rights. But during that same year, 1948, we had the Nakba and the welcoming into the ranks of the United Nations by the ethno-supremacist state of Israel. We also had the welcoming into the International Body of Nations the nation of South Africa, the apartheid nation of South Africa. So while the declaration represented a advancement in terms of the kinds of principles and values that would serve as guides for states and for the general public, because of the contradictory nature of the human rights ideal itself, we see these kinds of contradictory practices. And what do I mean by contradictory elements of the essential ideal of human rights? Well, uh, classical liberalism was fraught with contradictions. The notion of the rights of quote unquote man, the fundamental natural rights of human beings, was always limited by a short-sighted understanding of who qualified as a human. In that process of struggle around these ideals, it was quite clear that most non-European peoples had not achieved the status of human beings. And as a consequence, the social contract and the full range of what became classical Western liberal ideas was limited. Of course, women weren't part of that process either because they were not perceived to have the ability to engage in reasoned thought. So the limitations of who qualified to be human and what rights were rights that needed to be respected and recognized and fulfilled was contained from the very beginning of this European Enlightenment, a moment that we are taught in our history books was a collective advancement for human beings, but yet it was really quite provincial and quite limited. So what we see today, my friends, is the consequences of those contradictions. And we saw what we see today is a process that we saw evolving from the very beginning of this human rights framework. That when, for example, African Americans and others were raising issues of the contradiction of human rights, when through our advocacy at the United Nations, we were pointing out that there was a fundamental connection between racial oppression and colonialism in the US and beyond. The response from the Western nations was not to adapt the framework, to expand it, but to do what? To repress those efforts. In 1951, the Civil Rights Congress, utilizing the idea that there was something called a genocide that was promulgated in 1948, using that framework, it submitted a petition to the United Nations that said that we charge genocide, meaning the African American in the United States made a credible argument that the Genocide Convention, in fact, applied to Africans in the US. The response from the United Nations and the response from the US in general was basically to repress, to push the whole idea of human rights to the margin, basically to even criminalize the ideal of human rights. In fact, they made the connection that if you were an advocate for human rights, you were also a potential and possible communist. So the framework has been fraught with contradictions from the very beginning. And that's why we say that as a consequence of the work that we were doing at the UN, we meaning the African American liberation process, we developed what we refer to today as the people-centered approach to human rights. This is the Black radical tradition, the Black radical approach to human rights, one that looks at this framework very critically, that recognized these contradictions, that saw how human rights was instrumentalized as a weapon for imperialism. And therefore, we believe that the only way that this ideal of human rights to have any kind of relevance to those of us who are oppressed and exploited, that it had to be decolonized. It had to be restructured. It had to be abandoned. Now, what we say is this, just like it's obvious that there have been these standards, and we have heard information that of all the nations on the planet that failed to sign and ratify the International Convention on the Rights of the Child is the United States. And the very fact that we had this convention is very important. A number of the instruments that have been produced over the last few decades have been very important in terms of establishing various kinds of values and mechanisms for recognizing and protecting human rights. But we also see too that that process of advancing in a real and sincere way has been undermined by the powerful states of the West. That has been used again to justify their intervention into various nations. If they were serious about the equal application and protection of human rights, for example, then there will be an outcry even among themselves against the use of sanctions against nations around the world. Sanctions that clearly, and today we saw the evidence once again, that clearly violate the rights of numbers of human beings, including the most precious right, which is the right to life. But the U.S. and the Western and the collective West have always been hypocritical about this notion of human rights, but they used it up until recently. We argue that because of the deepening crisis of this global imperialist system, that even the pretense of a commitment to human rights has been abandoned. That they see now human rights as a yoke, preventing them from utilizing the full power of their state in order to continue the process of consolidating not only fascism in the US, but global fascism. And therefore, they have abandoned that and they are imposing these systems on us. And that's why we say that if we're going to engage in utilizing this framework or the ideal of human rights, it has to be transcended. Let me offer what we say is a people-centered approach to human rights. We say that human rights has to emanate from the people out of struggle. And that definition that we use for people-centered human rights is this. We say that people-centered human rights are those non-oppressive rights that reflect the highest commitment to universal human dignity and social justice, that individuals and collectives define and secure for themselves and collective humanity through social struggle. Now, as you can see, this definition is a description of the process and represents an ethical framework as opposed to a prefigured list of items defined as representing human rights. This is one of the key differences between the liberal framework and people-centered human rights. The people-centered human rights asserts that human rights must be created from the bottom up. That it cannot be limited to any national legal regime or to the normative standards reflected in international human rights treaties, covenants, or declarations. Human rights has to come out of the objective needs and aspirations of the people. And when we say the people, we say this. The definition and the reality of a peoples is a consequence of a political process. You construct the people out of struggle. And we say that there is a basis for people-centered human rights. And while we move away from the state-centered and legalistic foundation of liberal human rights or classical human rights, we're not abandoning the idea that there is a foundation for human rights. We say that the foundation has to be different. And what is that difference? We say that what becomes human rights, what is legitimized as human rights, comes out of the struggles of the people. It is the people themselves in struggle that determine the legitimacy of human rights. And that is our approach to the process. It is an open-ended process, an open-ended approach that says basically, if you understand the full potential of human rights, the struggle for human dignity, and its demand for the material needs that can define and protect human dignity, then you understand that what this framework implies is a revolutionary objective. We say very clearly, emanating from this framework, that the demands for clean water, safe and accessible food, free quality education, healthcare, and health for all, housing, public transportation, wages, and with a socially productive job that allows for a dignified life, the ending of mass incarceration, universal free child care, opposition to war and the control and eventual elimination of the police, self-determination and respect for democracy in all aspects of life are some of the people-centered human rights that can only be realized through a bottom-up mass movement for building popular power. So this is the people-centered approach, one that implies, if we look again at these elements, or some of the elements that we say define human dignity, it implies that the full realization of people-centered human rights cannot really be realized within the context of this global capitalist system. What we see with the healthcare process in Cuba is a healthcare process on a different foundation, one that in fact centers the needs of the people, that elevates human dignity. And it's quite clear that in Cuba we have a socialist system. We're not going to be able to arrive at the same place in the West, in the US, as long as we have the continuation of this backward colonial capitalist system. So the task for us, we believe, in order to ensure that Cuba remains free, that we are able to push back on the inroads made in Venezuela, that we end the illegal war against Iran, that we liberate Haiti and bring about independence in Puerto Rico, that we eject the US from our region that is in the process of attempting to recolonize the region. That if we are able to define for ourselves the one or two nations that represent an existential threat to global humanity, then we have to name the enemy. In the people-centered human rights framework, we in fact name the enemy. There is no neutrality here. And we say that enemy has to be seen as the pan-European colonial capitalist white supremacist patriarchy. And until we are able to end that, we're not going to be able to realize the full range and possibilities of people-centered human rights. So the task is clear before us. This is a call to action, a call to struggle, informed by this alternative ethical framework. And we hope that this is one of the messages, one of the lessons that come out of this very important conversation today. So thank you for indulging me for a few minutes.
Thank you so much, Ajamu. Jill, I believe you have a slide to share now.
Yes, and here we go. So I just, since we are the Americas Without Sanctions, I don't want to fail to mention Nicaragua. Nicaragua has not yet suffered the severe impacts that Cuba and Venezuela have suffered, but it also has made tremendous strides in health and particularly child health, but these achievements are threatened as well by escalating US sanctions. So we have some discussion questions, and we ask you to help us improve these before we launch the toolkit, which is this PowerPoint presentation within the next week or two on the Sanctions Kill website. But I'll just let you have some thoughts. I think we have actually a deeper discussion about what really constitutes human rights based on what we presented in our toolkit, and especially the very thought-provoking comments of Anai and Ajamu. So with that, I just offer the floor to you, Becca, to lead us in discussion.
Thank you so much, Jill. Yes, it looks to me like there's a lot to talk about here. Again, if anyone wants to add any questions or comments into the Q&A section, that would be great. That way we can answer them. Maybe we can just start the discussion with a broad question to ask all of our panelists where you see hope. And perhaps we could start with Anai. Is there a place where you see hope with regards to the anti-sanctions movement for Venezuela?
Of conscience, information, and people that are organized that raises its voice against these coercive measures. I think spaces like this one give me hope. Popular organization that we are seeing gives us hope. Having managed to construct models of social inclusion like our own, obviously that gives me hope. It's a very complex time because organizations that should take decisions like the UN are definitely colonized and are incapable of giving an answer to the problem, and that just tells us that we shouldn't allow the world to be without laws. There are initiatives of different countries. For example, there was a group that raised opposition to coercive measures in the United Nations. And so they declared the 4th of December as the day against these measures. It's a little symbol, but it's relevant so that other countries raise their voices against these measures. This is a very complex moment. It requires profound changes. Neoliberal policies, capitalism, within those, it's very difficult for us to develop human rights, women, children, teenagers, because it's based on a profound inequality, exploitation, and a disposable idea of what a human being is. We need to organize ourselves to construct new models, new public policies that bring about more equality from a perspective that is not colonized and that shows our struggles. I want to share, I'll give it to you later on, the second book that I am writing on Simón Rodríguez, who was one of the teachers of Simón Bolívar. It was about the rights or it is about the rights of children from a decolonized perspective. It doesn't come from an Anglo-centric or European-centric perspective. We need to do that. We need to produce knowledge and methodologies that give tools for popular organizations in their struggle to construct a model where there is less inequality. In the end, these coercive measures are expression of power. They are a colonial policy, a war policy that seeks the maximum amount of suffering of our people in order to get electoral successes. our peoples are uncomfortable to the United States because we defend our dignity. What we do is defend self-determination of our country and our right to use a model that expresses who we are and guarantees the rights of children.
Muchísimas gracias, Anaí. Ajamu, do you want to share with us places where you see hope?
I see hope basically globally. I see hope in the fact that you see opposition to the attempt to consolidate global fascism around the world. I mean, but we're not naive either. We also see the opposite. We see that in Western Europe, there is still the rise and consolidation of far-right parties. We see in the US that there is no political choice between a far-right fascist MAGA movement and a rightist neoliberal fascist configuration. And so it suggests that we are going to be facing some very difficult tasks in the US, in the West, and globally, because it's quite clear that the collective West, Western imperialism, led by the US, has concluded that it's going to attempt to maintain its global hegemony or it will blow up the fucking world. So we have tasks before us. Within that context, we see struggles taking place. Someone said they don't understand the use of struggle. We see resistance taking place in our region, in the Americas. We see resistance in various parts of the planet. And we see resistance and we understand, if we have a certain kind of perspective, that the conditions that are creating these contradictions are such that these contradictions cannot be reconciled, and that the historical trajectory is one for radical global social change. So that sense of where we need to go as collective humanity, that understanding that when you have oppression, you always will have resistance. It gives hope to all of us who take up the mantle of being a revolutionary. Chase said to be a revolutionary is to be an eternal optimist, and that is a requirement. And that's why we have not only hope, we're going to transform that hope into concrete resistance.
Thank you so much. Jess, where do you see hope?
I mean, I'll answer in like very literally. Like I'm a high school teacher in Miami, and I teach history and kind of a whole bunch of other things. But I teach world history, and as a lot of you could imagine, it is a very difficult place to teach history in. And I think one thing that for me has provided me hope is that like I have a lot of students that are questioning kind of the blockade and the way that their parents tell them, like kind of like the history that they're telling them about the blockade against Cuba, and the ways that they talk about Venezuela and Cuba too. Like I definitely hear them asking questions that like I think I compare when like I was in high school, were questions that like were not really brought up. So like I think for me, I mean, it's a very short answer, but I think it's just like the first kind of moment that comes to my head of just like people starting to like question what it is that is like the usual narrative that is like kind of spoken about in places like Miami, and kind of like all of these polls that are coming out saying that like everyone in Miami, or like kind of Cuban Americans in Miami, overwhelmingly support the invasion of Cuba. Like that's not like there are people that are resisting that, there are organizations in Miami that are resisting that, and yeah, I mean, I think that that's just, I'll kind of leave it there, but I would say like that's just kind of how I see it in like my everyday life. Yeah.
Thank you, Jess. The hope in the youth. Jill, would you like to add something?
Sure. I would just add that Jess is part of that hope in the youth. She just went to Cuba for the first time last month. So we've seen the fruits of that here today. And I also wanted to respond to someone in the chat who said that what do you mean by struggle? We've posted some campaigns that we'd love you to support, which is a way for you to struggle with us or to tell people a concrete thing to do. I gave the link to the sanctionskill.org. We meet Tuesdays, usually once a month. We're meeting this coming Tuesday. Please put your email in the chat or directly to me if you want to get an invitation to Tuesday afternoon's meeting. There's the Zone of Peace, which the Black Alliance for Peace helps coordinate to connect social movements throughout the Americas to help build the zone of peace that the CELAC countries proclaimed in 2014. And that's to resist the growing U.S. military presence in the region. And it also includes demand to end sanctions. And also, I hope before we finish today that Ajamu will explain a little bit about the move to do what was done to South Africa for decades before the election of an all people's government, which is to deny countries committing apartheid and genocide the ability to participate in international sporting competitions. And so Ajamu is very instrumental in a campaign to move the games for the World Cup and to deny the US and Israel the ability to participate in Olympics competition. And also, another thing that gives hope is I think that public opinion is at a turning point regarding the benign nature of unilateral coercive measures. It's because of our work, it's because there's a growing movement amongst us, ordinary people, pressuring our members of Congress, and that members of Congress are not the only way to measure success. But it is shown in the fact that they are holding a briefing. Congresswoman Delia Ramirez is holding a briefing precisely on this topic about how unilateral coercive measures kill children. That's going to be this Wednesday, the 22nd, at 1 p.m. The Republicans heard about this and scheduled their version of sanctions at the same time. So we had to move up ours. The Congresswoman very astutely moved up hers. And then the Republicans moved up theirs again, but I think that we still have an hour to. So at any rate, I'm going to share again a link for the Code Pink event for anyone who is in the Washington area, and also look for our mailings for how you can contact your member of Congress and be sure that they get the message that we want them to attend that briefing. But it's really all of us. It's not that we're expecting Congress to save us. It's that we're building a movement that they can't ignore. So those are my contributions.
It's wonderful to have concrete actions that people can take part in. I know that we also have here on the webinar with us a number of doctors, nurses, and other healthcare workers and people who work in the area of healthcare. And it's important, of course, for those folks to also reach out to their colleagues and people they know who work in healthcare to talk with them about the way that sanctions are affecting children in particular, especially because of their interest in healthcare and children. Can Jill or Jess, can one of you reiterate how folks can connect with medical professionals against sanctions?
Well, there is Doctors Against Genocide, and they have adopted sanctions. They saw the sanctions and blockade on Gaza as leading to genocide before October of 2023. They see what is happening to Cuba as moving in that direction. And Sanctions Kill has a health worker sign-on letter that if you sign it, today or tomorrow will be the last day. We have to close it for signatures because we're going to be presenting it to Congress in a couple of days, and I'm going to post a link to that letter in just a minute.
Thank you so much. There's also a question in the Q&A from George Pock about do people in the United States, does the public know that they are killing so many children. Is the U.S. public aware of the effect that these unilateral coercive measures have on children? Ajamu, do you have thoughts?
I would say that I think the public has a better understanding of the potential consequences of policies of attacks on people as a consequence of the live stream genocide from Gaza. And that what that does, that provides an opportunity for Sanctions Kill and other organizations to make the connection between what people saw in Gaza to ongoing policies by the U.S. Many people don't know the information that was shared today. Many activists, let alone the general public. And so that's why these kinds of public educational activities geared at this point primarily to activists is important because people are thinking more critically now. People are understanding the moral implications of their government involved in criminal activity. So yeah, I think people are becoming more aware, and that's what's generating, I think, the growing anti-war sentiment in the U.S.
Being movement forward.
Should be done in Venezuela to help the children who have been psychologically affected also by these measures. Can you tell us about what is being done or what can be done in terms of the psychological effects, not only in terms of physical health? Well, first of all, I would like to comment in relation to the previous reflection that, in fact, truth for us, it is very important that the American people can understand what these coercive unilateral measures mean. There is not only an impact right now, but also for the future, because a child that does not receive adequate food or medication at a certain moment, he is going to be affected in their development. And of course, all of these efforts like this one are very useful, very helpful, because this is a topic that is not addressed in big media, monopolies, not only in the US, but also in our countries. The issue of coercive measures and sanctions is a very necessary topic of debate and discussion because it has been promoted also by some that these are very specific measures that affect only individual people, and they are actually actions that affect the people at large, and they are part of extermination and genocidal policies. It is important to understand that these measures are non-conventional war strategies. They kill people, they cause consequences. There are people who die as a result of these actions. So all the forums, activities, all awareness creation activities are very important. And I agree that the world is opening their eyes much more. Unfortunately, we have been forced to see a genocide occur on TV, everything that is happening in Gaza and in other parts of the world. But we need to transform that powerlessness into action. And there are many programs that are being developed in Venezuela, going to your question now, that to address the psychological impacts of all these coercive measures. Very recently, also with the military activities that took place on January 3rd. This has affected families, that's affected children, teenagers in their daily lives. Also the development of language in children, their ability to sleep well. These are unfortunate consequences of war, and there are several spaces and many organizations that are working on this. If the comrade that asked this question lives in Venezuela, I can give her my email. I can post my email in the chat box to see where she lives, and we can get together. I can give her information about psychosocial attention to children and teenagers. Of course, this psychological care is very important. Sometimes coercive measures are seen as only economic measures, but these are actions that impact on the psyche, on psychological, on aspects of people, on their health. There is a cognitive war that's being waged and also brings deep consequences. And it is in their objectives. It has to do with the objectives of these measures that have to do with dividing society, demoralizing society, creating division. So we need to work with children and with families at large because it has been 11 years already of deprivation, of hindered development of their full rights. Thank you, Anaí. As you are saying, these measures have a cumulative factor here because a child that does not get adequate nutrition when they are children are going to be more expensive patients for the system that pays for their health throughout their lives. So the cumulative factor has economic implications, has psychological implications in the lives of people, but also in the health services offered by the government in this case.
I think we have just a couple minutes left for final comments from our panelists. Jess, do you have any final comments?
I mean, yeah, the only comment that I have is just like there were some resources that I was gonna go into very quickly about like kind of like milk banks and different like programs. So just to be on the lookout for like the toolkit and like the resources that we're going to be like distributing, where we could talk more extensively about them if you're interested. And please feel free to reach out to me if you have any questions about anything I said, or if you want the PowerPoint, or if you have any comments or feedback. I would really appreciate that. And thank you all for letting me be here.
Thank you, Jess. Ajamu, do you have any final comments?
First, let me thank the organizers for this outstanding event. Let me share with the public that I think Jill alluded to it, that we operate on multiple fronts, and we are challenging the oppressors and in every area. One thing that's happening that's going to have the effect, if it's pulled off, is to legitimize and normalize the international criminality of the U.S. state and Israel, and that is with this state being allowed to host the World Cup, an event that is usually seen as a celebration, something that brings the globe together, even though it's competitive. We say we have to, out of principle, we have to oppose that. We cannot allow this criminal state the prestige of hosting these games. And this is, in fact, part of what has to take place to delegitimize the U.S. and its fascist partner, Israel. We have to put real teeth in the process of isolating these two states, boycotting those states. They have put in place attempts to try to undermine the attempt to boycott Israel. But what about the U.S.? We say that the U.S. should be boycotted by every civilized nation and people on this planet until it decides to re-enter the community of civilized nations. So we say, please look at, is in the chat, the Move the Games link. Join us in raising this issue, endorse the campaign. We are moving into the second phase of this, which is to organize opposition in the 11 cities where the games may take place. But we know we're getting traction on this call to take the games out of the U.S. Globally. So help to be part of that process. Remind people of this contradiction in your areas. We also say too, please check out the work that Jill and others are involved in right now in raising the issue of making our region, we say our region meaning the Americas, a zone of peace. that this was a call that was made in 2014 and is more relevant today than ever with the efforts on the part of these maniacs in DC to try to recolonize our region. And we have to push them out, which means we have to push out the US bases. We have to build opposition in these nations where we have US bases. We have to resist a militarization, and we have to struggle around the continuation of the undermining of Venezuela and the siege on Cuba, recognize the occupation in Haiti, and call for the liberation of Puerto Rico. We've got to engage and struggle, my friends. That's how we defeat fascism.
Thank you, Ajamu. And
to strengthen the ties of unity and organization between our different movements. To us, it is also, all this information is very important so as to debate it and discuss it and disseminate it here in Venezuela, what organizations in the US are doing, that there are other voices that are struggling against the imperial actions. Of course, I would also like to call you to a large global movement against unilateral coercive measures and the barbarism of imposing these measures on any country, trying to control their resources. It's important to respect sovereignty and dignity of all nations. Without a doubt, we need to join together all our efforts to fight against the genocide in Gaza and other countries, and that today needs us to call it out, to denounce it, and it needs our solidarity. I would also like to tell you that from Venezuela, we are a peaceful people. We are a people of love. We have fought and struggled all these years to consolidate our social inclusion model that we have today, the capacity to mitigate these measures through a system of universal health care free of charge and laws and regulations that put children at the center of our policy as human beings, as subjects of rights. We will continue to advocate for peace, but peace with social justice, with peace through struggle. And we would like to thank you for these efforts because it is the struggle of barbarism against, it is the struggle of humanity against barbarism. Thank you very much. Thank you, Anaí.
Y la humanidad sin duda clama por todas nuestras voces y esfuerzos. Gracias.
Gracias, Anaí. Jill, do you have a final comment?
Just briefly to echo, really support everything that the other panelists said and combine Anaí and Ajamu's remarks. This is the world fighting against barbarity and fascism. And we hope that our campaign here about raising awareness of child deaths is another tool that you can use to push back against what is happening to us and to add to the movement against unilateral coercive measures and say, what on earth could ever justify this mass killing of innocents? Who is violating human rights and who is respecting the right to life and human dignity?
Thank you, Jill. I want to thank all of our panelists for your participation today. I think it's been a really rich discussion and a lot of very good information. We look forward to the release of the toolkit shortly so that we can spread that far and wide. We also want to thank our interpreters, Mercedes and Giselle. Thank you so much for your time today. We really value your good work. And thank you once again to Ajamu and Anaí and all of the Americas Without Sanctions team and all the co-sponsors today. We'll see you next time. Thank you.
Thanks, everyone. Bye.
Thank you. No compromise, no retreat.
No compromise, no retreat.